All right, everybody. If you are starting this after spring break, hope you had a good spring break. If you're doing this during spring break, hope you enjoy and hope everybody's surviving. And we're going to go and move on to chapter 13 of our lifespan, making it in midlife, the biopsychosocial challenges of middle adulthood. So that would be some of us in here, and that would be me. So we're going to move on and talk a little bit about those objectives. So we're going to begin chapter 13 asking these basic questions. Why might some argue that middle age is the prime of life? What stresses do middle-aged adults experience? What are relationships like with middle-aged adults and their children? What about their parents? This is this time of their life where they may still have children at home and yet have to take care of their parents. So what does that look like? We'll explore that as we explore chapter 13. We'll be also going over the physical changes in health during middle adulthood. We'll be addressing how does appearance change in middle age? What changes occur in bones and joints? What reproductive changes occur in men and women in middle age? What is stress? And how does it affect physical and psychological health? What benefits are there to exercise? So this is the time where adults achieve new heights in cognitive development, they reevaluate their personal goals, and they change their behaviors if they choose. They've developed adult relationships with their children and even become grandparents. Along the way, they've dealt with stresses. They've learned how to deal with them. They learned how to deal with challenges. Usually at this point, their health is generally good. They're at the peak of their earning potential. So they have a lot of wisdom. They have money and things to do. This is the time that we start to think, what does chronological age mean, opposed to perceived age? Studies have found that 8 in 10 Britons believe that the line between young and old is much fuzzier than it used to be. Is 40 the new 30? Let's take a look and see what the experience of midlife is. Physical changes in health. Turning 40 is usually regarded as the beginning of middle age in the United States. What physical changes start to occur? Well, crossing the boundary to middle age from young adulthood, especially in the United States, is typically associated with turning 40. As people move into middle age, they begin to experience different physical changes associated with aging. What do you think some of those changes are? Vision, hearing, physical ability? Let's take a look. So, what are some changes in appearance in middle age? What can you think of? Common changes include wrinkles, gray hair, male pattern baldness, and weight gain. Wrinkles are caused by changes in the structure of the skin and its connective and supportive tissues, as well as the cumulative effects of damage from exposure to sunlight and smoking cigarettes. So you can tell people in their 40s who smoked or were sunbathed a lot. You can tell they have lots of wrinkles on their face. Their skin doesn't look as young. And it may make you feel better knowing that gray hair is natural and caused by a normal cessation of pigment production in hair follicles. It's just another way of growing old, right? Some people get it earlier than 40 and some later. It's all genetics, right? Male pattern baldness is also a genetic trait in which hair loss progressively, beginning from the top of the head, often begins to appear in middle age. Most middle-aged people also notice that their clothes don't fit anymore, right? We start to gain weight. And one of the reasons is that our metabolism starts to slow down. But sometimes our eating habits don't. We sometimes keep the same eating habits. We don't maybe move as much, and yet our body isn't burning as much calories because we are not growing. We don't need them. Most people, you might see that infamous middle-age bulge, right? The fact that these changes occur to many people is what matters most. This is a common occurrence throughout middle age that brings middle-aged people together. So changes to men and women are often interpreted differently, right? So we're going to look at that as well. So one of the changes that we're going to talk about is changes in bones and joints. So loss of bone mass occurs after menopause in women. So menopause can be in your 50s to your 60s, so after that, and in late life for men. And what that means is the bones and joints change with age, sometimes in potentially preventable ways, and sometimes because of genetic predisposition or disease. And one of those diseases is osteoporosis. And that's a disease in which bones become porous and easy to break. They're caused by low bone mass at skeletal maturity, calcium and vitamin D deficiencies, estrogen depletion, which is why that occurs. Women after menopause have a higher risk of bone loss because without menstruation, they're not getting that estrogen they need, like we talked about, and lack of weight-bearing exercises. They can be prevented or delayed by getting enough calcium and vitamin D. So that's why they tell you to drink your milk. Vitamin D you get from the sun. You want to do weight bearing through your upper extremities, your arms now, and your legs, because weight bearing actually stimulates bone growth. It's a very important factor to know that if you want to get bone to grow, even when you're healing a fracture, they'll tell you to start putting weight on a bone to stimulate that bone growth. So the important thing is to remember that osteoporosis tends to happen with women because of that estrogen depletion is a major one cause, and then the calcium and vitamin D deficiency. So what you're looking at here are changes in appearance of bone. On the one side is the osteoporotic bone tissue, which you can see is very porous and open. And if you look at the other side, at the normal bone tissue, you can see it's very woven with intricate bands across it. So as you can imagine, putting weight through that normal bone tissue, you're going to hold up your weight. Putting weight through that osteoporotic, you're very at risk for having a fracture. So a lot of people that have osteoporosis will have what's called a pathological fracture, and that is just from putting weight and doing normal daily activities because the bone is so weak it can't even tolerate that. Very common is in the hip, the femur bone, or in the spine, spinal fractures. With these, especially in the spine, it can cause the person to stoop and become shorter. Many treatments for spinal fractures, some include what's called a kyphoplasty, where they increase that in between the bone there, they put a little material in there to support it, or they'll have to wear braces. About 40 million Americans either have osteoporosis or at high risk due to low bone density. So it's a huge problem, and it's one we see many, many times in the hospital. And if you're going to be in the medical field, you will as well. One of the things you want to remember is that as you age, you lose the water in your disc between your vertebrae as well, and that aids in decreasing the height, your overall height. That's what gives you that height, that water in that vertebrae. And many people as they age will with this osteoporotic changes and with the loss of that water will have those pathological fractures. So just remember that don't necessarily have to have a fall or a traumatic event. They can just break on their own. Looking at that picture, you can see why. So this is a picture of what I was talking about earlier. It's that change in curve and how you get shorter with those bone changes, those osteoporotic changes. So you can see in that first picture, nice posture, good disc. As those discs lose water and the bone becomes less porous, it collapses on itself to where you can see the last picture, the curve is significant. That decreasing curve is called an increase actually in thoracic kyphosis. Kyphosis is that kind of bump on the back where you see a lot of older people have, and that is a telltale sign of osteoporosis. So this is a video on osteoporosis, and I'm going to attach it in the module. I'd like you to watch it. It's very short, 5 minutes, and it'll show you all the changes of on the bone, and it has very neat graphics on it, and it'll there'll be a question on the test from it. So look in the module, and it'll be there for you to watch. So this chart is looking at the required calcium and vitamin D from infants to adult women and men over 70 years. So if you remember from the slide before that the major deficiencies of calcium and vitamin D, along with estrogen depletion and lack of weight-bearing exercise, is one of the biggest causes of osteoporosis. So you can see infants need 200 all the way up to adults, men and women at 1200. So that's a significant change. Recommended calcium and vitamin D intake for men and women of various ages, and this is determined by the Institute of Medicine. Women who are late, middle-aged, or over 65 are encouraged to have their bone mineral density tested. They do that by having a dual energy X-ray absorptiometry, a DXA test. And what this does is it measures bone density at the hip and spine. And remember, those are the two areas that tend to have the osteoporotic changes, right? Hip fractures and spinal fractures, the two most common pathological fractures. The DXA test results are usually compared with the ideal or peak bone mineral density of a healthy 30-year-old adult. The larger the difference in terms of bone mass loss between your scores and the comparison, the greater is the degree to which you have osteoporosis. So you can actually have a degree of osteoporosis. You can have, so if you're very high on that, you're very, very at risk for fractures. So you really want to, therapy is actually a really good thing for it because it can do weight-bearing exercises and teach safety and mobility to prevent falls. Women who have been diagnosed with osteoporosis have options regarding treatment and should consult their physicians, right, for the best one. They have medicines and, like I said, therapy and just education on how to take care of their bones and joints. Because the biggest thing that a detriment to older adults is a fall and a hip fracture, and can definitely decrease their lifespan. So another change in bones and joints is arthritis. So we're going to talk a little bit about that. So basically, protective cartilage in the joints begins to deteriorate in a person's 20s. So what is cartilage? Cartilage is that cushion in your joints that allows you to weight bear and have pain-free movement. So osteoarthritis is a disease, because itis is a disease of the bone, of the joint. It's a disease marked by gradual onset of bone damage with progression of pain and disability with minor inflammation. So basically, it's a wear and tear disease. It basically wears down your cartilage, wears down the bone, so that what they say is you have like a bone on bone of your knee joint or your hip joint. So can you imagine how painful that would be if your bones were rubbing together and there's no pad or protectiveness in that cartilage? Osteoarthritis generally occurs in late, middle age, early old age, because it's a wear and tear. You have to have time to wear out your joint. And it definitely depends on the activities you do. Did you do a lot of kneeling, a lot of squatting, a lot of up and down stairs? Could you imagine a catcher, a professional major league catcher? There's a reason why they can't be in that position too long, opposed to a first baseman, right? So it's what you do, how aggressively you do it will increase that wear and tear, and will determine when those pains and when that arthritis shows up. And again, it's most common in manual laborers, athletes, etc. As a physical therapist, we see, this is one of the major diagnoses we see in clinic. We see them before they have surgeries to help promote range of motion and strength and techniques to prevent pain. We see them during, after surgery, and we see them after they have their full recovery. So the typical surgery to repair this would be a total joint to replace that worn out bone. So most common are knee and hip, and then the shoulder. So now we're going to go over the second type of arthritis that causes joint pain. Rheumatoid arthritis, which is a disease of the joints that affects different joints and causes different types of pain. Whereas osteoarthritis was a wear and tear type of arthritis. More likely you see as you get older and depending on the activities you do. Rheumatoid arthritis is actually an autoimmune disease where the body fights itself. So one of the main differences is that usually you'll see in osteoarthritis, it'll present unilaterally or on one side because it depends on what activities you're doing. Whereas rheumatoid arthritis can affect all the joints in your body, so you're more likely to see it present itself bilaterally. So you might have bilateral knee pain, bilateral hand pain. One of the telltale signs of rheumatoid arthritis is as they get older, you'll notice in the hands, they'll start to curve and look deformed. But we're going to go a little bit more over the rheumatoid arthritis. So it's more destructive than osteoarthritis because it's actually the body fighting itself. So it's actually a disease process instead of an external force causing the wear and tear. Swelling is a major factor that needs to be controlled. So with osteoarthritis and rheumatoid arthritis, NSAIDs, which are a pain reliever with an anti-inflammatory component, are often prescribed. So when treating arthritis problems, the pain stems through swelling, stiffness, and that bone to bone. So they're going to give you medicine that controls swelling and pain, and that's what an NSAID is. So Tylenol, Aleve, Advil, those are all NSAIDs. They also give corticosteroids to rheumatoid arthritis. That's a very strong anti-inflammatory, and then anti-rheumatic drugs. So that's very specific drugs to fight that autoimmune component of rheumatoid arthritis. There is no cure for rheumatoid arthritis, but there are several treatment options that we talked about. And therapy can also be helpful. And some patients with rheumatoid arthritis also go on to have joint replacement surgeries. Sometimes rest, passive range of motion exercises also can be very helpful. So here's another video I'd like you to watch, osteoarthritis versus rheumatoid arthritis, a very short video explaining the difference. It'll be in the module as well with the osteoporosis one. And again, there'll be some type of question on the test regarding this. So make sure you watch it. You can even pause this and go watch it right now. So this is a good table to sum up the differences of the changes in bones and joints, the three things we talked about. So on one side, you're going to see the risk factors and physical effects, and then you're going to see those three categories: osteoporosis, osteoarthritis, and rheumatoid arthritis. So you're going to see age-related osteoporosis, yes. As you get older, your bones get weaker. Osteoarthritis, yes. As you get older and you do more, you're going to have more wear and tear. Rheumatoid arthritis, no, because it's based on autoimmune. It's actually a disease process that your body fights itself. So it does not matter what age you are. You can get it at any age. And you can go on and look, menopause, another big one we talked about, right? Menopause, the reason that you have, you're more likely to get osteoporosis in menopause. Do you remember why? It's that estrogen. When we stop getting estrogen, the bones stop absorbing that calcium to keep them strong, right? The calcium, vitamin D. So menopause is a factor for women. And then remember, for men, it's later in life. So you can even go down and look. Remember when we talked about anorexia nervosa? So osteoporosis, yes, it's a risk factor because if they're not eating and not getting the proper nutrition, their bones can actually get weaker earlier in life. And osteoarthritis, no, and rheumatoid arthritis, no. So it's a great table to look and see specifically what causes those changes in bones and joints. So during this middle adulthood, one of the main things that happens is the reproductive changes. We started to talk about that already with the menopause, right? So another thing I want to talk about is climacteric, which is the biological process during which women pass from their reproductive to non-reproductive years. So this transition is through menopause, the point at which menstruation stops. So this whole process starts way before. It can take up to 5-10 years before you have complete menopause. So there's a lot of changes. How many of you have been around maybe your parents or yourself, if you're depending on your age, hot flashes, right? Mood changes, a lot of hormone changes, different. A lot of things happen through that period before complete stop of that menopause. Perimenopause is the individually varying time of transition from regular menstruation to menopause. So it begins with irregular periods in the 40s and is usually complete by 50 to 55. And it varies from woman to woman, just like when your periods start. Lots of different factors. Stress, genetics, when your mom began perimenopause and menopause can affect when you will as well. So there are many people getting pregnant in their 40s, 50s, where some people become having in their late 30s. So it definitely varies with stress and genetics. So that major reproductive change in middle adulthood for women is the loss of the ability to bear children, right? So opposed to that young adult where they're starting that reproductive, this is where that changes. So it has a lot of psychological aspects as well. But even with these changes, which are differently for men and women, right? The AARP took a national survey and they found that middle-aged adults continue to enjoy active sex life. So just because the reproductive and biological process is changing, they are still having active sex lives. So we're going to keep talking about this a little bit. Decreases in hormonal levels can, like I said before, result in hot flashes, night sweats, headaches, mood changes, low libido, etc. And it varies between different women, varied on genetics, environment, stress, and can vary on time lapse too. Some have long perimenopausal, some have shorter. One other thing that happens, not just on the hormonal level, but there's actual physical changes to women's genital organs after menopause. The vaginal wall becomes thinner with decreased vaginal lubrication. Women's genital organs undergo that progressive change after menopause. And you also get some shrinkage of the external genitalia as well. These changes have important effects on sexual activity, such as increased possibility of painful intercourse and a longer time and more stimulation needed to reach orgasms because of the change of the physical to the genital organs. So they don't respond as well. So they may need some help, may need some lubrication to achieve that. But they found that even with this, that active sex lives are still there, and usually the reason isn't because of the difficulties physically of having sex, but more that they just can't find the right partner to share that with. Overall, menopause is seen in women as a big change from one part of their life to the second part of their life, right? Not being able to bear children is a huge thing. But it varies from culture to culture. For example, women in the Mayan culture of Mexico and Central America welcome menopause as it changes as a natural phenomena and do not attach any stigma to aging. where sometimes people in the United States, if you're not of childbearing age, you might be referred to as old. And some women have more difficulty with that. So, is menopause really an end to childbearing? As you recall, we talked about other ways to conceive a child: in vitro fertilization, pre-genetic and diagnostics, PGD, and fertility drugs, right? So in vitro fertilization and fertility drugs can allow post-menopausal women to have children. So the question is, because they can have children, should they have children? Do you think it's ethical to have a baby in your 40s, 50s, 60s? Last year, a 74-year-old woman who gave birth to twins in India. Is that ethical? Is she physically fit to take care of her children? What would happen if she died within 10 years? Is it fair to the child? Is it to the parent? Some things to think about. Like I said, just because you can do it doesn't mean you should do it. And men have even higher chance, right? They can still conceive children in their 80s and 90s. So just because you can do it doesn't mean you should. Estrogen loss after menopause can lead to not just osteoporosis, but other disease processes, cardiovascular disease and incontinence. So as women hit midlife and they have the loss of estrogen, they're transitioning into their older years, they have to think about other things. So in response to this increased risk to the estrogen-related symptoms that women experience, one approach is the use of menopausal hormone therapy. So to replace that estrogen to prevent these diseases, they have menopausal hormone therapy, MHT. Women then take low doses of estrogen, which is often combined with progestin, a synthetic form of progesterone. This hormone therapy is controversial and has been the focus of many research studies with conflicting results. There appears to be both benefits, obviously the ones shown above, and risk. With some of those therapies with increased estrogen like that, it has an increased risk of cancers. So women have to make that decision. Some women choose to do more natural replacement that doesn't have as many of the benefits, but may have less risk. So let's not forget the men during this experience, right? They have more gradual changes, but still as significant. Men experience less changes than women. They have a gradual decline in testosterone levels and quantity of sperm. So we talked about testosterone being the hormone contributed to maleness. So as they age, they lose that, as women lose estrogen. And as most men experience that gradual decline in testosterone levels, they never completely lose the ability to father children, even with that lower quantity of sperm. They can still father children into their 80s. Like I said before, is that ethical? Another reproductive change is the prostate gland becomes enlarged and becomes stiffer. Prostate cancer is a huge risk during this age group. Many doctors make men take what's called a PSA test around their 40s to detect if they have prostate cancer. Following an extensive review of research and clinical evidence, the American Cancer Society recommended that men with average risk of developing prostate cancer be informed at age 50 of the benefits and risks of the available diagnostic tests, which include a digital rectal exam or prostate-specific antigen blood test, and that's that PSA. Men over 50 should work with their physician to determine the best course of action for diagnosis. So depending on your doctor, some may start you at 40, but the average is 50 to get that PSA test. Another problem men have as they age is the need for longer time and more stimulation to achieve erection and orgasm, right? Most of you have seen the ads for medications such as Viagra that can help men maintain an active sex life into late life, right? Viagra helps with erectile dysfunction. It helps maintain an erection. Other things that they can do is get an erectile pump, which is inserted into the penis and the scrotum. So different options to maintaining that active sex life. So as with women, as long as men enjoy sex and have a willing partner, sexual activity is a lifelong option. And as for women, the most important ingredient of sexual intimacy for men is a strong relationship with their partner. So all these problems, no matter if they're men or women, their reproductive changes, research has shown is not what determines the decline in sex life. It's based on the relationships that they have with their partner. So let's move on to stress and health. So I want you to picture a middle-aged person and look at them compared to a young adult and an older adult. What do you think their stresses are? How do you think their health is? What kind of questions and what kind of things are this population looking at? So short and long-term stress becomes most apparent at middle age, right? So as a result of financial obligations, worries about losing one's job, marital problems, parents, poor health, etc. It's during the middle age that effects of both short and long-term stress really become apparent. It's partly because it takes time for stress disorders to manifest themselves, right? And partly because you're having that gradual loss of physical capacity. So it's when you're starting to see that decline. You kind of reached your peak and now you're starting to go down a little bit. So that can be very, very stressful. You're stressed about your children and you're stressed about your parents and you're stressed about what is going to become of your changing body. Stress and coping paradigm emphasizes the transactions between a person and his environment. So how do middle adulthood people deal with their stress? Example they use in your book is, suppose you're stuck in a traffic jam. Depending on whether you're late for an appointment or have plenty of time on your hands, it's going to determine how much stressful you are, right? If I have plenty of time to make my appointment, I'm not going to be worried, right? I'm going to be relaxed. But if I'm late, that stress is going to increase. That's that stress and coping paradigm. It depended on the environment, the actual situation. Driving itself does not cause stress, but being late opposed being early is going to affect that stress. So how we interpret an event, such as being stuck in traffic, is what matters, not the event itself or what we do in response to it. It's the interpretation of the event. So looking at this picture, you can see that the physical markers of stress are the result of complex and dynamic psychological processes, right? You can see the guy has a stressor, that's that environmental demand. You can go and see the dotted lines as appraisal of the demands and how well that person can adapt. It can lead on to a positive or stressful perceived, right? We talked about, oh, I have lots of time, I'm stuck in traffic. Or, oh, I'm so late, I have a negative response. And then through that, you're going to have physiological or behavioral responses, right? Your heart rate goes up, your blood pressure goes up, you're sweating. Behavioral, you're angry, you honk the horn, you flip somebody off, right? Or are you calm, listening to the music, peaceful? And depending on your response, as you can see in the last box, you're going to have increased risk of physical and psychiatric disease. So just imagine if this happens multiple times through the day, how is that going to affect your health? If your stress paradigm is so actively in that perceived stress with negative emotions, you're going to have more physical and psychiatric disease. So stress is a normal part of our life. We deal with it on a daily basis. What they found is that short-term stress can be beneficial. It can motivate us, help us to get things done. But long-term stress can be dangerous to our health or even deadly. Being under chronic stress, it suppresses the immune system, resulting in increased susceptibility to viral infections. So everybody right now, control your stress, right? We don't want anybody affected by any viral conditions. It can increase your risk of atherosclerosis, and that's the buildup of plaque along the walls of the arteries. And that results in the arteries becoming stiffer and restricting blood flow. And with the restricted blood flow, increases your chance of stroke and heart attacks. And hypertension, high blood pressure, right? When you're in a stressful situation, your blood pressure increases. It also can lead to impaired memory and cognition. Experiencing negative events tends to lower immune functioning. So if you're doing this throughout the day, it all adds up. Pretty soon, a stressful life can cause you to be sick. So when they say that, can stress, affect your health? Yes, it can, because it's the way your body responds to it. And over time, that response continues. It's actually going to have physiological changes. Clogged arteries, increased blood pressure, memory loss. That's how stress affects your health. But experiencing positive events tend to improve immune functioning. So if you cope well with stress, it can actually help you be healthier. So let's look at some of those ways that we cope with stress. So stress results from the appraisal of events, right? The event itself doesn't cause the stress, it's our interpretation of it. So how do we cope with it? Coping is any attempt to deal with stress. You can have good coping skills and bad coping skills. Some people cope with direct action, others with emotional responses. For example, you may cope with a messy roommate by moving out, right? You're just taking this, you're solving the problem. My roommate's messy, I'm going to leave the situation. Another time you might react at an emotional level. That would be like feeling sad after a breakup with your partner. You just have the stress of being alone and sad. Sometimes people cope by simply redefining the event as not stressful. An example of this would be saying that it's no big deal that you failed to get that job you wanted. Life goes on. And still others focus on spiritual or religious approaches with prayer and faith, asking God for help. So out of those coping mechanisms, which ones do you think are most beneficial? Which ones do you think would help you? Which ones have you seen help others? It's a key to understanding how people deal with their life. And another way very important in the healthcare field, to understand their overall health. If you're just looking at the physical and not the emotional and the stress and the psychological, you're going to miss out on a lot of signs and symptoms. So as I stated earlier, cardiovascular disease is one of the negative effects of stress. It has a well-known connection between stress and cardiovascular disease. Decades of research show that stress is related to hypertension and other forms of cardiovascular disease. And even the perception that stress impacts one's health is associated with increased occurrence of myocardial infarction or a heart attack. So just thinking about being stressful can have cardiovascular effects. Stress also influences how people react and behave, right? Experiencing stress can trigger psychological processes and reactions. Although stress does not directly cause psychopathology, it does influence it, right? How people react and behave to different stressors can influence that psychopathology. For example, the stress many people experienced after the terrorist attacks, right, on September 11th, resulted in higher levels of anxiety experienced through nightmares, flashbacks, insomnia, traumatic grief, emotional numbing, and avoidance, similar to post-traumatic stress syndrome, right? Hence the name. So think about all that and experiencing all that. You can imagine what that would do to your physical health. So again, it's very important to understand the psychological part of stress if you're in the healthcare field or any type of field, because you're going to understand the physical better as well. So one of the most common known stress disorders is post-traumatic stress disorder, PTSD, right? We talked about that with 9/11. And it's an anxiety disorder that can develop after exposure to a terrifying event in which grave physical harm occurred or was threatened. The kinds of traumatic events that may trigger PTSD include violent personal assaults, natural or human-caused disasters, accidents, or military combat. So it could be even, going onto an airplane that had a turbulence and the oxygen mask came on. Going back on an airplane could be very traumatic and produce those same effects. Our military, right? Very, very common population with this. Multiple exposure to terrifying events, right? Personal assault, abuse. PTSD affects nearly 8 million Americans and can be a debilitating condition, right? If you can't get past that, you can't sometimes function in just the normal daily activities of life. Because not everyone who is exposed to a very stressful situation develops PTSD, our understanding of what causes it is limited. Why do some people get PTSD and another doesn't, even though they experience the same traumatic event? Could it be brain chemistry? Could it be psychological, environmental? Think about all the things that we learned about how people develop. Could some of those causes give you a predisposition for that? Hard for scientists to know. Treatment is typically done through psychotherapy with the addition of certain antidepressant medications in very limited circumstances. So the help that they need definitely comes with talking about it and seeking psychotherapy. So now we're going to talk about how do we reduce stress in our lives? What kind of things do you do to reduce stress? Do you exercise? Do yoga? Count to 10? Let's examine some of the strategies that is given in your textbook. So one popular one is called mindfulness-based stress reduction. And it's being aware and non-judgmental of whatever is happening at the moment. For example, right? Yoga, meditation, it's being one with the moment, not judging the moment and letting it go through you. Common approaches using mindfulness-based stress reduction, yoga, meditation, indicate that these techniques have many positive effects on physical and psychological health. In addition, mindfulness techniques result in functional and structural changes in the brain. So it actually changes the way your brain processes. Changes probably the connections, right? Especially in areas related to control of stress and emotion, which makes sense, as well as attention, memory, and sensory processing. So if you can keep yourself less stressed, your brain is going to work more efficiently. And that's what we all need. If you're under a lot of stress, your brain has too much to process. And those areas of mentation decrease, right? So very important to relax and reduce your stress. So another stress reducing activity is exercise. What benefits do you think exercise has on stress, on your health? Well, let's define exercise first. Aerobic exercise places moderate stress on the heart by maintaining a pulse rate between 60 to 90% of the person's maximum heart rate. So what that means is that you have to get your heart rate up to about 60 to 90% to have any kind of effect. So they found that 150 minutes of moderate intensity, or 75 minutes of vigorous intensity per week is recommended. Evidence suggests that this regular exercise, in conjunction with the healthy lifestyles that we discussed in Chapter 10, can slow the physiological aging process. So being sedentary or not moving is hazardous to your health. And if you do get sick, then it will take you longer to recover if you have a sedentary lifestyle. I see this all the time in the hospital. I can tell immediately the patients that have a healthy lifestyle, that exercise, walk on a daily basis, because when they get, say, pneumonia or they have a heart problem, they're going to recover so much faster because their body already has a strong baseline. People that don't, their body's already weak, so it takes twice as long to get that strength back. Benefits of exercise: improve cardiovascular functioning, maximum oxygen consumption, lower blood pressure, and increase flexibility. All things that help with the aging process that not only help you live longer, but live better longer. Exercise also helps lower levels of stress, produces better moods, and better cognitive functioning. So you can imagine, if you're exercising, getting up in that 60 to 90% heart rate, not just sweating without the benefits, you're getting that increased oxygen to the brain. That's the nutrients to the brain to create increased connections, right? With those increased connections, you're going to have better memory and better cognitive functioning. So points to remember when beginning an exercise program. Always check with your physician before beginning. You want to make sure you don't have any pre-existing conditions that may cause adverse effects when you're exercising. So get cleared. Moderation is important. You don't want to overdo it because your body needs to have time to recuperate and rest. You need to build up. And you also don't want to wear and tear on your joints. So finding that middle ground is key. And your intent to exercise must be turned into action, right? The hardest part is getting started and following through. So it's consistency, consistency, consistency. That is the key to getting the benefits of an exercise program for your health and stress, along with getting that aerobic exercise portion, 60 to 90% of your heart rate. Otherwise, you're just sweating. All right, so let's move on to cognitive development in the middle adulthood. So let's think about, how does practical intelligence, and what is it, develop in adulthood? How does a person become an expert? What difference are there between adults and young people in how they learn? So we've thought about how children learn, to adolescence, young adulthood. Does it change as we get older? Let's find out. The hallmark of cognitive development in middle age involves developing higher levels of expertise, showing flexibility in solving practical problems, For an example, a complex tax form. So I'm sure in your life you've heard or had somebody tell you, think practical. What's the practical solution? Well, what is that? What does that exactly mean? Let's delve into the ideas of practical intelligence. Practical intelligence is the range of skills related to how individuals shape, select, or adapt to their physical and social environments. So let's think about it. A middle-aged woman is frying chicken in her home when all of a sudden grease fire breaks out on top of the stove. Flames begin to shoot up. What should she do? A man finds that a heater in his apartment is not working. He asks his landlord to send someone to fix it, and the landlord agrees. But then, after a week of cold weather and several calls to the landlord, the heater is still not fixed. What do you think he should do? These are all practical problems, right? Things that happen in everyday life that need to be fixed. How we determine the best way to do that is practical intelligence. A lot of times you hear common sense, right? They don't have common sense. They're very smart, but they don't have common sense. So what they found is it does not decline until late in life. So that's why you may see that really elderly person, not safe to live at home, right? They may catch, a kitchen fire. They may leave the stove on, that type of stuff. It's highly emotional, and instrumental problems are dealt with differently. And problem solving in middle age cannot be characterized in one way. Lots of different skill ranges. So we're going to delve in a little deeper and find out what specific types of practical intelligence there are. So let's delve into practical intelligence a little bit more and break it down. So it can be thought of as the mechanics of intelligence and the pragmatics of intelligence. And with that, there are two different ideas. Mechanics of intelligence is the aspect of intelligence compromising what they call fluid intelligence. So it's more influenced by biological factors. The pragmatics of intelligence refers to those aspects of intelligence reflecting crystallized intelligence. But however, this is important, Balt's research shows that biopsychosocial forces differently influence the mechanics and the pragmatics of intelligence. So you really need to look at and know Baltz's theory. Whereas the mechanics of intelligence is more directly an expression of the neurophysiological architect of the mind, the pragmatics of intelligence is associated more with the bodies of knowledge that are available from and mediated through a person's culture. So that's Balt's idea. So you really want to know Balt's idea for the test. So let's think about it. Fluid intelligence consists of the abilities that make you a flexible and adaptive thinker. It allows you to make inferences and that enable you to understand the relations among concepts. So that's more biological. It's kind of what you have there. Crystallized intelligence is that knowledge acquired through life experiences and education in a particular culture. So it's acquiring knowledge, right? So the example they give here is America's adult knowledge of the Civil War, right? You're more influenced by psychological and socio-cultural forces. It's what you've learned throughout your life. So the older you are, the more crystallized intelligence you have, right? Because it's that pragmatic. If someone says you're a pragmatic person, that means you have good knowledge and you apply it well. So this figure shows the differences between mechanics and pragmatics. So if you look at the two circles over there, you can see they cross over. So that middle part of it is where they have in common. So there's a lot of things they don't have in common. As you can see, mechanics is content poor. It's not knowledge based. It's universal. It's biological, genetically predisposed. Whereas pragmatics is all that is a knowledge, right? So it's really content rich. It's culture dependent, how you perceive, what you've been exposed to, experience based. So you can see you have more pragmatic intelligence as you get older. Mechanics actually declines as you get older because it's that reasoning and inference. So that process, as you age, deteriorates as your brain dies. But you're always getting knowledge, right? Because you're acquiring that knowledge. So it's experience based. So as you can see, pragmatic stays about the same. It gets better, but that mechanics is how you process the information, how you can apply the information gets worse. So that's fluid, it's changing. Crystallized pragmatics, it stays pretty consistent. As you gain knowledge, you're going to stay with that knowledge. Becoming an expert. What does it take to become an expert? Are you an expert at something? Can you think of the time that you invested to reach that skill level? We're going to explore that a little bit. So everyone becomes an expert at something, right? Work, sports, interpersonal relationships, etc. We tend to select areas that we want to become experts in and remain amateurs or novices in others, right? You have to have a liking and interest in it. Just like we talked about cultivating those enriched kids, you have to have an interest in something to become an expert. It's very difficult to become an expert in something you don't like, right? So, what makes experts better? Well, they know the alternative ways of solving problems, right? They are the experts, so they think of every solution that's possible. They should be able to help the novice work their way and know multiple ways to do it. They can bypass steps that novices need, right? They've already perfected it, so they can predict where you're going to have your failures or your setbacks, so they can bypass those steps. And they're flexible and creative with rules, right? They think outside the box. They know that by doing something differently isn't going to necessarily cause failure. It can actually cause success. Even though experts may be slower in terms of raw speed because they spend more time planning, their ability to skip steps puts them at a decided advantage. In a way, this represents the triumph of knowledge over reasoning. Experts build up a wealth of knowledge about alternative ways of solving problems or making decisions. These well-developed knowledge structures are the major difference between experts and novices, and they enable experts to bypass those needed steps. So that knowledge base is the key to deciding all those things that make experts better. So they found that expert performance tends to peak at middle age and then drops off slightly. Can you think of your professional athletes? How many 50-year-olds do you have in professional sports? Can you think of sports where 40-year-old, 30-year-old is your peak? Think of gymnasts, right? So one of the outcomes of expertise appears to be a decrease in the ability to explain how one arrives at a particular answer. It seems that the increased efficiency that comes through merging the process with the product of the thinking comes at the cost of being able to explain to others what one is doing. So if you become such an expert, sometimes it's hard to explain how you got there. So like I think about expert typist, right? If I had to tell you how to type each letter, I can't really do it. But if I put my hands on a keyboard, I could just show you. So sometimes you become such an expert, you forget all the little steps because it's so ingrained in you. But in turn, that makes it difficult to explain to a novice how to get to your expertise. Knowledge is based on experience is an important component of that expertise, right? So the more experience you have, the more knowledge you'll have as well. And just remember that those athletes that going to the Olympics at, hitting their peak at 40 in their late 30s are the exception to the rule. So you guys are beginning your learning process. Can you imagine going to school for the rest of your life, always learning? Do you think that's an important aspect of being a middle adulthood? What happens if you do not take on that trait of lifelong learning? Let's talk about it. So we're finding many companies profess a focus on training employees to learn how to learn rather than focus on learning specific content. That's one of the main things that colleges are supposed to teach their students. It's called an intellectual virtue, and it was developed by Aristotle. It's the process of not what you know, but how do you think and how do you acquire that knowledge? That skill is very important in the working profession, right? How do you stay current and adapt to the ever-changing work environment? You need to know how to think and make decisions in crucial times in your life. So how do professionals stay current in their fields? For me personally, I do the first one. I have to take continuing education credits. My board, a physical therapy board, requires me to take 30 units every 2 years. So it's about 2 days worth of class. And if not, I can't keep my license. There's online learning, there's certificate programs, right? Your job may actually have classes that teach specific new skills, computer skills. What are some of the things that you've seen in different professions that would require them to stay current in their field? Lifelong learning is gaining acceptance as the best way to approach the need for continuing education and for retraining displaced workers. But should lifelong learning be approached as merely an extension of earlier educational experience? So your books show that Knowles, Swanson, and Holton argue that teaching aimed at children and youth differs from teaching aimed at adults. Adult learners differ from their younger counterparts in several ways. So they actually have classes for adult learners, and you guys are all considered adult learners. So I'm actually have taken classes in education, and the name of the class is an adult learner class. So thinking back on how you learned in school and how you're being in like high school and middle school, and now what your teachers are teaching you how to learn, what do you think is the major difference? If you look back to that statement we talked about earlier, right? It's not just learning facts, it's learning how to think. And that's one of those intellectual virtues that makes adult learners different from young people learners. Adult learners differ from their younger counterparts in several ways. Adult learners need to know why they are learning something before undertaking it. They need to know the reason why they should invest their time and energy into learning something. They're not just going to trust you at face value. They need to see the value in it for them. Adult learners are also going to enter a learning situation with more and different experiences to build on. So I can see myself back when I was a student at 20 and myself as a student now. I have 20 years of experience. I'm a totally different student because now I can understand what they're saying. When I went back and got my doctorate, I already had 16 years of physical therapy. I had many experiences to build on. So when they were talking about the patients and when they were talking about conditions, I could actually have input, and it made my learning more valuable because it took it up to another level. Adult learners prefer to learn things that are necessary for real-world problems. So adult learners want to know, what benefit is this going to have in my everyday life? How is it going to solve the problems that I need to be solved? They have a lot more meaning attached to their learning experience. So you've got to show them why it's important. Adults are most willing to learn those things they believe are necessary to deal with real world problems rather than the abstract, hypothetical situations. So they're more motivated to learn by internal factors rather than external factors. So internal factors are self-esteem or personal satisfaction. And those external factors are such as a job promotion or a pay raise. So those are your adult learners. So lifelong learning becomes increasingly important. So educators need to keep in mind that learning styles change as people age, right? So we have a lot of different ages in the class. So my job as a professor is to understand how you, during your different life events in your life, learn. Effective lifelong learning requires smart decisions about how to keep knowledge updated and which approach will work best among different learning outcomes. So you got to learn how to learn. So you got to know the best way that you learn. Is it visual? Is it auditory? Is it written? How am I going to apply that in my real life? How am I going to learn those techniques to continue throughout my life, to advance in my job, to advance with my relationships? Those make a strong adult lifelong learner. So now let's talk about personality in middle adulthood. We're going to go over the 5-factor trait model and what evidence is there for stability in personality traits. Do we continue that same personality that we were at 20? What changes occur in people's priorities and personal concerns? Do you think you have the same priorities you have when you're 20, when you're 40? What do you think will change? And how does a person achieve generativity? How is midlife best described? Let's delve in. So what do you think of when you think of someone experiencing a midlife crisis? If you had to put a picture in your head, how would you describe it? What age would they be? What would they look like? What behaviors do you think? For me, I think of that person maybe changing partners, maybe getting divorced, buying a sports car, getting a young girlfriend, changing jobs. That's that typical, stereotypical idea. But is that really what a midlife crisis is? Let's think about it. There are several competing theories exist for explaining personality in middle-aged adults. What changes in midlife that would cause these behaviors? So the topic of personality development in middle age is one of the oldest debates in theory and research on adult development and aging. Many people believe strongly that middle age brings with it normative crisis called the midlife crisis, right? But is everything as it seems? Just like what I was talking about earlier. Are those stereotypes of midlife crisis, are they really true? Middle-aged adults is grounded in several competing theories, one being the psychodynamic approach that we actually talked about in Chapter 1. And another difference is that much of the research is considered as longitudinal research. So that means over that same person over their entire life. So we can actually see those personality changes. So now we're going to talk about those personality theories in middle adulthood. First one being stability is the role, the 5-factor model. So Costa and McRae's research shows 5 dimensions that describe adult personalities. And they found that one of the most important advances in research on adult development and aging has been the emergence of a personality theory aimed specifically at describing adults. And so due to most of their efforts, we are now able to describe these adult personalities, and there are 5 dimensions. So neuroticism, extroversion, openness to experience, agreeableness, and conscientiousness. These dimensions, the so-called Big 5 traits, are strongly grounded in cross-sectional, longitudinal, and sequential research. So they have very good support for the research, so we can take their findings with a strong correlation. So neuroticism. So these are the people that are high on this dimension are anxious, hostile, self-conscious, and impulsive. They may show violent or negative emotions that interfere with their ability to get along with others or to handle problems in everyday life. So people that are low on this dimension tend to be calm, even-tempered, self-content, comfortable, unemotional, and hardy. So these are your people that may be your type A that are very, very, high strung, anxious, have a short fuse, very critical of themselves, do things impulsively. And those type B personalities are those really, really calm. Nothing bothers them. You can't get a rise out of them, right? So you know these people. You've seen them. Picture someone with the high scale on this and the low scale. Try to keep those persons in your mind so when you're thinking about the test, you can have a picture of those people. The next one is extroversion. So those high on this dimension, love, social interaction, talking, stimulation. And the people who are low on this dimension tend to be reserved, quiet, passive, serious, and emotionally unreactive. So again, picture those people. These are your outgoing, like your extroverts and your introverts, right? Outgoing, love to talk, right? And have lots of friends, maybe have lots of boyfriends. They need to be stimulated. They can't sit at home. So these are the people that are probably having a very difficult time right now being on home quarantine, right? Are you one of those people, or are you one that are calm, kind of passive, serious? Maybe, you don't want to be around a lot of people. You don't need a lot of stimulant. You let other people make decisions for you. You may be serious, So think about those people. Have a picture of each high and the person on the low. The third one is openness to experience. And those that are high on this dimension have a vivid imagination and are willing to try new things. And those that are low on this dimension tend to be down to earth, uncreative, conventional, uncurious, and conservative. So they tend to be followers, and the ones high on this tend to be the leaders, right? They're naturally curious about things. They make decisions based on situational factors rather than absolute rules. Those are the ones that will jump in, let's go on a trip around the world. Artists, a lot of your actors probably, right? They can see things. They have imagination. They want to go experience life. And the other ones are the ones that follow them in those experiences, maybe. They are more rooted, down to earth. Maybe they're the ones that are working that job every day. They like the mundane. They don't like change. Those are your openness to experience. So again, picture someone that is high on that and low on that. It's going to help you visualize these personality traits. The fourth one, agreeableness, is those high on this dimension are accepting, cooperative, and caring. Those low on this dimension demonstrate high levels of antagonism, tend to be ruthless, suspicious, stingy, antagonistic, critical, and irritable. So type A would be a low, would be low on this dimension. So kind of similar to that other one, the neuroticism we talked about earlier. And conscientiousness, now everybody has probably heard of this. Those who are high on this dimension tend to be hardworking, ambitious, energetic. Such people have a strong desire to make something of themselves. People at the opposite end, the low spectrum of this dimension, tend to be negligent, lazy, disorganized, late, and aimless. So these 5 personality factors, can you see people fitting into these? Can you see yourself in one of these? Which one would you choose for yourself? They found that these same 5 factors appear across cultures, so very applicable across cultures, the world. So no matter where you are in your world, there's 5 personality traits are consistent. And by age 30, personality traits appear to stop changing and become set. So we've learned through this whole semester how we're developing and changing, and do we, as we develop and we gain more experiences. So when does that stop? So they've determined through research about the age of 30 is when you become set in your personality. So think of what you want to do by the time you're 30. And if you are 30 or past, do you think this is true? So this theory has very good research behind it. There's a longitudinal study that showed individuals change very little in personality traits over the 30-year period, with them looking at them from ages 20 to 90. So remember that longitudinal study means that the same people, and they're going to study them at different points in their life. So even though this has good research, there is a growing evidence that both stability and change can be detected in personality trait development across the adult lifespan. So Staudinger and colleagues suggest that personality takes on 2 forms. So this would be another theory. They believe that there's adjustment and growth. So personality adjustment involves developmental changes in terms of their adaptive value and functionality. For example, whether one can function effectively within society and how personality contributes to everyday life running smoothly. Personality growth refers to ideal end states such as increased self-transcendence, wisdom, and integrity. The most likely answer is that personality growth or change across adulthood does not normally occur unless there are special circumstances and an environmental push for this to occur. So personality-related adjustment that grows in adulthood does so in response to the ever-changing developmental changes and tasks, such as establishing a career, marriage, and family. So that's what another theorist, Staudinger and colleagues, discovered. Also, they found that, not they, but research has found that neuroticism may actually increase and extroversion may decrease with age. So extroversion is a good example, right? So think about as we get older, with a lot of physical changes, mental changes, you may lose your hearing, your sight. Think about people who can't hear well. Do they want to be in social circumstances? Are they going to be as outgoing? Probably not. That's one of the reasons why you'll see that extroversion decrease with age. So again, as we can see, the 5-factor model is very popular and it's supported with great evidence, but it's not perfect. And there's other theories out there that suggest that there is growth and change, but it depends on the environment. Something has to force that change. So now let's look at change is the rule. What are our changing priorities in midlife? So think about the priorities in young adulthood. School, finding a job, figuring out what you want to do, who your partner is going to be in life. Are you going to marry? Are you going to have kids? Where you're going to live? Now, what do you think you would be thinking about in midlife? You may have already established your career, right? Your children may be grown. What are the priorities now? Generativity means being productive by helping others to ensure the continuation of society by guiding the next generation. So it's the idea of sharing what you've learned to the generation below you so that they can continue progressing and learn from your mistakes and your advancements. It's one of Erickson's stages and is obtained through parenting, mentoring, and etc. So despite the evidence that personality traits remain stable during adulthood, many middle-aged people report that their personal priorities change during middle age, right? In general, they report that they are increasingly concerned with helping younger people achieve rather than with getting ahead themselves. So that's what that generativity is. They want to help others more than they want to get ahead because they've lived it. They've already experienced it. They want to help the younger generation experience success as well. Erickson argues that this shift in priority reflects generativity, or being productive by helping others to ensure the continuation of society by guiding the next generation. So achieving this generativity can be very enriching for middle life. It gives them purpose. It gives them something to do when they've already met most of the goals in their life. It can be very rewarding. There are many ways that generativity can be obtained. We talked about parenting, mentoring, creating one's legacy by doing something of lasting importance. A lot of your professors are doing that, right? They're teaching and passing on their knowledge to you so that you can carry it on. Some adults, however, do not achieve generativity. Instead, they become bored, self-indulgent, unable to contribute to the continuation of society. Erickson referred to this state as stagnation. So it makes sense, right? You're stagnant, you're not changing. You're not helping, you're just not changing. People are unable to deal with their needs of their children or to provide mentoring to younger adults when they're in this stagnation phase. So this is McAdams' model of generativity. You can note how one shows generativity action is influenced by several factors. So in this figure, the multidimensional model shows how generativity results from the complex interconnections among societal and inner forces. So you can see the tension between creating a product or an outcome outlives oneself and selflessly bestowing one's effort as a gift to the next generation. So you're showing your concern for society. And that results in a concern for the next generation and a belief in the goodness of the human enterprise. That's the belief in the species. The positive resolution of this conflict finds middle-aged adults developing a generative commitment, which produce generative actions. So those are those actions. So if you're concerned, you have a desire to help, you want to be needed, the culture needs you to pass that on, the traditions, the knowledge, and you commit to that belief in helping the species, then the action is going to be that generativity. So a person derives personal meaning from being generative by constructing a life story or narrative, which helps create the person's identity. So through all that, they're going to find meaning and it's going to give them purpose in their life. So what is a narrative? It's a way in which a person derives personal meaning from being generative. And by constructing a life story, it helps create identity. So for example, generative concern is a general personality tendency of interest in caring for younger individuals. And generative action is the actual behaviors that promote the well-being of the next generation. So generative concerns relate to life satisfaction and overall happiness, whereas generative action does not. For example, a new grandparent may derive much satisfaction from their grandchildren and are greatly concerned with their well-being. but they may have little desire to engage in the daily hassles of caring for them on a regular basis. So they care about their future, right? And they get very, very much satisfaction for them doing well. But do they want to do the day-to-day? Do they want to raise their children? No. So that's the difference between generative concern and generative action. According to McAdams, generative concern relates to life satisfaction and overall happiness, whereas generative action does not. So that's why they may say why grandparents love their grandchildren more than the parents do. They don't have to raise them, right? Just joking aside, that they get more satisfaction because they get to have all the good stuff. They get to pass on the traditions and see them succeed, but they don't have to do the daily guiding of that. So you can see why that would give you overall satisfaction and happiness, where the action and dealing with the day-to-day struggles of that may not. So how well do these ideas cross ethnic cultures? A few studies examine generativity across cultures in Cameroon, Costa Rica, and Germany, and they found that McAdams' model could be successfully applied across 3 cultures. This data demonstrates that personal concerns of middle-aged adults are fundamentally different from those of younger adults. In fact, generativity may be a strong predictor of emotional, physical well-being in midlife and old age. Women and men associate it with positive emotion and satisfaction with life and work, and it predicts good physical health. Considered together, these findings provide considerable support for Erickson's contention that central concerns for adults change with age. However, this data also indicate that generativity is more complex than Erickson originally thought. And while peaking in middle age, it may not diminish late in life. So let's get back to that midlife crisis. Does it really exist? What do you guys think? Midlife is no more or less traumatic than any other developmental stage. We've seen theorists such as Erickson believe that adults face several important challenges and that by struggling with these issues, people can develop new aspects of themselves. Another theorist, Carl Jung, one of the founders of psychoanalytical theory, believed that adults may experience a midlife crisis. This belief led to the development of several theories suggesting that adulthood consists of alternate periods of stability and transition, and that people experience it in a fixed sequence. So do we ask again, is there such a thing as midlife crisis? Not really. Despite its appeal, there's just no such thing as a universal midlife crisis. But researchers Lebeau-Veef and colleagues have some good evidence for a reorganization of self and values across the adult lifespan. So instead of a crisis, we're just reorganizing what's important in our life because it does present unique challenges and issues. So another way to view it, instead of a midlife crisis, it may be the result of general gains in cognitive complexity from early to middle adulthood. It's what all that stuff accumulates to. So the best way to look at it is gains and losses. Changes people perceive in midlife can be viewed as representing gains, losses, competence, ability to handle stress, sense of personal control, purpose in life, social responsibility. Whereas physical abilities, women's ability to bear children, physical appearance, they're all viewed as negative. The gain-loss view emphasizes 2 things. First, that exact timing of change is not fixed, but occurs over an extended period of time. And second, change can be both positive and negative at the same time. So rather than seeing midlife as a time of crisis, we may want to view it as a period during which several aspects of one's life acquires new meaning. both negative and positive. The ego resilience is a powerful personality resource that it enables people to handle this midlife changes. And those with high ego resilience experience it as a time for change and regrowth. So they're going to take the negative and the positive, and they're going to grow from it and become better coping adults. So let's look at family dynamics and middle age now. Who are the kin keepers in families, and what is a kin keeper? How does the relationship between middle-aged parents and their young adult children change? Who's taking care of who? And how do middle-aged adults deal with their aging parents? What styles of grandparenthood do middle-aged adults experience? How do grandchildren and grandparents interact? Let's investigate. So let's start with defining what a kin keeper is. A kin keeper is the person who gathers family members together for celebration and keeps them in touch with one another. So it's that person that keeps the family together. Can you think of someone in your family who organizes maybe all your family get-togethers or make sure everybody's staying in contact? Studies have found it's usually the middle-aged mother. Middle-aged mothers, more than fathers, tend to take on this role of kin keeper. So middle-aged people tend to be considered the sandwich generation. Can you imagine why? Well, right, they're sandwiched in between their older parents and their younger kids. Middle-aged adults who are caught between the competing demands of two generations, their parents and their children. So think about the major issues of facing middle-aged couple. They have to maintain a good marriage. They still have parenting responsibilities. They're dealing with children who are becoming adults themselves, that transition to adulthood. They're handling job pressures and worrying about their aging parents. Middle-aged adults truly have quite a lot to deal with in their everyday life of balancing the responsibilities between their children and their parents. So that's why they're referred to as the sandwich generation, because they are caught between the competing demands of their two generations. So during this middle-aged time, one children tend to leave home, right? Studies have found that most parents manage the transition successfully. Did your parents just kick you to the curb? Did they give you some financial support? Did they let you stay home while you're going to school? Right, it depends. So many parents still provide emotional and financial support if possible. They aren't heartless. They want to help you with this transition. They help with college tuition, a free place to live, maybe until you find employment. A positive experience with launching children is strongly influenced by the extent to which parents perceive a job well done and that their children have turned out well. So good kids are seen as a success. Children are regarded as successes when they meet parents' culturally based development expectations. What are some of the expectations your parents have set for you? Do you try to meet them? Do they know all the stuff that you do? Are you considered a good kid? And is that important? Approximately half of all young Americans return home after moving out. You can see some of the reasons: college debt, poor economic situation, and unavailability of jobs. Can you guys relate to some of this? What is the dynamics of your situation? So adult children's relationships with their parents often include a friendship dimension. Are you friends with your parents? Did you used to fight and now can understand each other better? Roughly half of young adults in the United States, we said, return to their parents' home, right? At least once after moving out. There's evidence that these young adults, called boomerang kids, because they're coming in and out, right, reflect a less permanent, more mobile contemporary society, and the difficulty they have in finding a meaningful life. So why do children move back? We talked about that, right? A major problem is the increased cost of living now, right? It's much harder to find jobs, good paying jobs, affordable housing, college debt. I can tell you that physical therapists coming out of school now with their doctorate have over $200,000 in debt. That's a house payment. How are they going to do that and get a house? All these factors play a part in coming back home. So if the societal economic situation is bad and jobs are not available, they're more likely to come home. If anybody's seen that older movie with Matthew McConaughey and Sarah Jessica Parker, that Failure to Launch, is a good example of this phenomenon. So now we're going to go to giving back, middle-aged adults and their aging parents. So who do you think takes care of their parents, the man or the woman? Think back to that kin keeper. Who tends to be the kin keeper, keeping the family together? It's the middle-aged mom, right? So it's the same idea here. The daughter or daughter-in-law usually takes the responsibility of caring for a parent. Why do you think that is? Is it based on stereotypes? That responsibility is considered filial obligation, a sense of obligation to care for one's parents if necessary. Adult children often provide the majority of care when needed to their parents in all Western and non-Western cultures, but it's especially seen in Asian and Latino cultures. Do you see that in our society, in Bakersfield? What do you guys think? A study in Japan even showed that although the oldest son is responsible for parental care, it is his wife who does the day-to-day caregiving for her parents and even her in-laws. So what do you think that experience is taking care of your parents? What's the problem in this generation? We talked about it earlier. It's the being in that sandwich generation, right? The conflict can rise from needing to care for both parents and one's own children. It's being pulled in two different directions. How do you maintain a job, take care of your children, and also take care of your aging adults that may need your attention, may have memory loss, may need to be driven places? How do you share that time and still have time for your spouse? More than 10 million Americans over the age of 50 provide unpaid care for older parents, in-laws, grandparents, and older loved ones. The costs of doing so are high. The typical daughter caring for a parent has a cost impact in terms of lost wages and Social Security and other retirement benefits of roughly $325,000. For sons caring for a parent, it's roughly $285,000. So caring for an elderly parent is not easy, and it's not usually happened by choice, right? Both of them would rather the older parent live independently. The financial cost, along with the conflict, can cause quite a burden. Caregiving is a major source of both stresses and rewards. On the stress side, adult children and other family caregivers are especially vulnerable from two main sources. They have trouble coping with declines in parents' functioning and the loss of their previous relationship. I can personally relate to this, as my father was recently diagnosed with early onset Alzheimer's. So seeing your parent going from a strong, very capable person to having declining mental is very difficult. Not only with the help that you have to provide for them, but also seeing them decline from their old self. It's emotional and taxing. If caregiving infringes on other responsibilities, the situation is likely to be perceived as negative. So when caregiving takes up the time of your normal life, For example, having to drive them to appointments, or they can't be left alone when you would normally be taking care of your own family or your spouse or your partner. That can have a negative effect and cause stress in your work-family relationships, your partner relationships. Also, you can get feelings of depression, resentment, and guilt. They're experienced by most caregivers at some point. So caregivers need to really take care of themselves. I know going through the Alzheimer's Association, there's a lot of research that found that caregivers actually sometimes pass before their spouse or the ones they're taking care of because of these stresses. They don't take care of themselves, and they end up having physical manifestations of these stresses. In some cases, adult children may even need to quit their jobs to provide care if adequate alternatives such as adult daycare are unavailable or unaffordable. The financial stress is another great stress that can cause a lot of problems. The stresses of caring for a parent means that the caregiver needs to carefully monitor her own health. Many professionals point out that caregiving for the caregiver is an important consideration to avoid caregiver burnout. We talked about work burnout, but there's caregiver burnout too. Can you see the similarities? But you can also have many rewards as well with caring for your adult parent. So caregiving is a major source of both stresses and rewards. And with that, it reminds us that the caregiver needs to monitor their own health to avoid burnout. And remember from chapter 12, the many causes of burnout, it applies here as well. So caregiver has its rewards, right? It brings parents and adult children closer together. It provides a sense of giving back. Cultural values influence the social support the caregiver receives. But parents are sometimes reluctant to receive the help. They don't want to be a burden. When caring for an aging parent, even the most devoted family caregivers will at times feel depressed, resentful, angry, or guilty. Many middle-aged caregivers are hard-pressed financially. They may be taking care of their children along with their parents. They're thinking about college tuition and their own retirement. They may have to work more than one job. Financial pressures are especially serious for those caring for parents with chronic conditions, such as Alzheimer's, that may require services such as an adult daycare. And that's not always covered by medical insurance. In some cases, adult children may need to even quit their jobs to provide care if adequate alternatives such as adult daycare aren't available. So the stresses of caring for a parent mean that the caregiver needs to carefully monitor those stresses. And it varies from culture to culture. But on the plus side, caring for an aging parent has rewards. They can bring the parents and the children closer together and provide a way for adult children to feel like they are giving back to their parents. Cross-cultural research examined Taiwanese and Chinese participants, and they confirmed that adults caring for aging parents find it very rewarding. Cultural values enter into the caregiver relationship, and that caregivers in all cultures studied show a common set of outcomes. Caregiver stressors are appraised as burdensome, which create negative health consequences for the caregiver. However, cultural values influence the kind of social supports that are available to the caregiver. Things aren't always rosy from the parent's perspective. They don't like losing their autonomy. They don't want to be a burden to their children. And they usually move, into their children's homes or into these long-term care facilities as a last result. Many adults who receive help with daily activities feel negatively about the situation. Although cultural norms supporting the acceptance of health, such as in Japanese culture, significantly lessen those feelings. So culture plays a big part on whether it's accepted or not. So just remember, misunderstandings can occur, and the frustration that caregivers feel may be translated directly into negative interactions. So it's very important for the caregiver to take care of themselves and to recognize the good and bad of caregiving. So this figure shows whether a care recipient perceives care to be good depends on interactions with the care provider and whether those interactions are perceived negatively. So you can see on the left are the characteristics that contribute to the interactions with the caregiver. And those create negative reactions and how that creates toward a psychological well-being. Most people become grandparents in their 40s or 50s. So how do grandparents interact with their grandchildren? Well, interactions may change over time or with different grandchildren. So it depends. A 40-year-old grandparent is going to act differently than a 70-year-old grandparent. Just like you parent your children different, your grandchildren different. They also perform societal functions that characterize being a grandparent, passing on family history. Maybe it's a favorite recipe, or they look at old photographs, or they teach a specific skill set. They are very important in passing that on. And they perform functions to gain personal satisfaction. So the personal dimension includes the personal satisfaction and individual needs that are fulfilled by being a grandparent. Many grandparents pass on skills as well as religious, social, and vocational values. That's considered the social dimension. Through storytelling and advice, and they may feel great pride and satisfaction, and that's the personal dimension. From working with grandchildren on joint projects. Grandchildren give grandparents a great deal back in return. Right? They make them feel a personal satisfaction. And they teach them new skills as well. Grandchildren keep grandparents in touch with youth and the latest trends. They may teach them how to use a smartphone or a computer, how to get on Facebook or Instagram. They keep grandparents on the technological forefront. So think about your relationships with your grandparents. How old were they? How did they treat you? Is it different now? Looking back, can you see some of this stuff occurring in your own relationships? Meaning that grandparents derived from their roles are associated with generativity. So you remember that giving back. Being a grandparent really matters. Most grandparents derive multiple meanings and they are linked with generativity. For some, grandparenting is the most important things in their life. For others, meaning comes from being seen as wise, from spoiling their grandchildren, or from recalling the relationship they had with their own grandparents. They can also take pride in the fact that they will be followed by not one, but 2 generations. So no matter what type of grandparenting style they have, they all find the role meaningful. Grandchildren value grandparents as role models. They show them how to build on altruistic beliefs when helping with frail grandparents, right? The act of helping their grandparents is one of the ways that they can form that altruistic belief that we learned earlier in the semester. And they derive both stress and rewards from caretaking. Grandchildren may get stressed by seeing their grandparent old and not being able to do as much. But they also get the rewards of the relationship, the positive feedback, learning something new, sharing an activity. So do you think interaction between grandparents varies across cultures or ethnic groups? Studies have shown that African American and Latino American families value intergenerational relationships. I know that I had a friend that they lived back east and the whole family lived on different floors of their apartment. Their family unit was very integrated between the grandparents, the son and daughters, and then their children. Native American culture allows people to serve as surrogate grandparents if biological ones are deceased or missing. They call that the fictive grandparenting. Native American and Asian American grandparents pass on many traditions, very influenced on their cultural and traditions. In general, Native American grandmothers take a more active role than do grandfathers and are more likely to pass on tradition and rituals. African American grandfathers, in particular, tend to perceive grandparenthood as a central role to a greater degree than do European American grandfathers. And Latin and Latino American grandparents are more likely to participate in child rearing because of cultural core value of family. Do you guys see that? Do you see different cultures affecting how the grandparents interact? Are one's more like parents? Or one's more like grandparents? So as I talked about in the last slide, many grandparents are taking care of their grandchildren, either through daycare type setting while the parents work, or through primary custody because the parents are incarcerated, passed away, addicted, or just unable to raise their children for some other reason. There are estimates about 7 million U.S. grandparents have grandchildren under age 18 living with them, and 2.7 million of these grandparents provide basic needs, food, shelter, and clothing for one or more of their grandchildren. So with those statistics, it's no wonder that they have several stresses in their life. Financial stress, increased burden, more mouths to feed, social isolation, won't have as much time for their friends or their activities. They've shown that they tend to have more problem behavior in the grandchildren they are raising, which would be understandable. The children don't have their parents. They're transitioning to a new environment. And it's disruptive to their own work schedule and commitments. They may not be able to work as much if they have to be the primary custodial caregiver. All these things make grandparenthood quite different in the 21st century than it was in the 20th century. Grandparents tend to have more independent lives apart from their children and grandchildren, so having to come back and raise them causes quite a disruption to their life. So by recognizing that and identifying these stresses, we can help them transition this much easier. Another important factor is that these stresses carry over into different cultures. For example, full-time custodial grandmothers in Kenya report higher levels of stress than do part-time caregivers. That makes sense. If you're a full-time caregiver and your primary goal is to take care of these children, you have a lot more stress than someone who just maybe watches them during the day while their parents work. Even custodial grandparents raising grandchildren that don't have any problems report stresses. They're done raising their children. So adding that dynamic, thinking about going back to that stage, being maybe a young adult, that can be stressful. They're past that in their development. So they're having to learn those skills again in an ever-changing environment. But just remember, most custodial grandparents consider their situation better for their grandchild than any other alternative and report surprisingly few negative effects on their marriages. So unlike we were talking about earlier, the stress on a marriage with them taking care of their grandchildren and their parents, grandparents find that taking care of their grandchildren doesn't cause any more negative effects on their marriage, and that grandparents as a whole would do anything to take care of their grandchildren. They think they are the best alternative. What do you think? So that concludes chapter 13. It's a little bit longer chapter, so it's a little bit longer lecture. You can break it up and not do it all at one time. You have 2 weeks to do it, and this will be the beginning of the next exam. So if this is the end of your spring break, hope you had a great spring break. If you're starting early, enjoy your spring break. We'll be moving on to the older adult in chapter 14. Again, if you have any questions, feel free to email me, and remember to watch the 2 videos that are going to be attached in this module, osteoporosis and rheumatoid arthritis and osteoarthritis. I will have questions on the test for this. All right, everybody have a great week and talk to you soon.